All right, welcome back. Just before we go ahead, while we did discuss with Olanrewaju Suraj, the aviation minister did show proof of appropriation. Documents was also shown, and it was leased and not borrowed. So I guess Mr. Suraj missed some part of that one. But we're moving on to our next focus today, and we're joined now by Dr. Francis Faduyile, who is the chairman, Nigerian Medical Association in Lagos. Thank you for coming on this morning.
Thank you. Good morning.
Okay. Yes, we have seen that report, and this is in the front burners. NMA has suspended the strike. Who knows? They may go back to it next year. What's the bone of contention?
Well, the bone of contentions are clear. Importantly, what NMA is asking for is to see that we improve the health of the populace in the country. The first thing we have been asking for is to improve the funding for health. Nigeria has been a signatory to the WHO charter that at least 15% of the annual budget should be allocated to health. And since that time, Nigeria has always been sub 5%. In fact, the last year was less than 5%, 4 point something. And we are also advocating, asking for the universal applicability of the National Health Insurance Scheme so that we can have comprehensive health. And apart from that, we are also discussing about some distortion in the hierarchical situation in the health system.
What are those distortions?
Well, I know that my friend who was here was talking about the position of doctors vis-a-vis the position of other graduates. I don't know if I can just quickly go there and use it to highlight my point. Medical doctors pass through university for 6 years, 6 full years, not semester system. Semester system is three months, making six months, making a year. But a medical doctor does his own training January to December. So our 1 year is almost the same. If we want to put it in semester system, 2 years. So if he's saying it's just 4 and 6 years, and he's thinking it's just 2 years, no, it's far, far more than that. And that is why when medical doctors are placed, they are placed because of the rigors of the intense nature of training. And pharmacists too, because they spend 5 years, semester system, they spend 5 years, while others enters at level 8, pharmacists enters at level 9. The same thing for the law graduates. So, if you're saying that doctors have been unduly put at an advantage position, no, it is because of what it entails. I agree. The situation is when a patient comes to the hospital, he actually comes for his treatment of his ailment. And the person in the center of this treatment is the medical doctor. And when the medical doctors decides to do this, call other paramedical officers to support, they come and do the support.
Why you call them paramedical? Who are paramedics?
Paramedics are people who are support staff of the medical practitioners.
Who are they?
They are every other professionals apart from the medical doctors. Because the history of medical practice is that the doctors do all things. Is the doctor who now decides that he wants to do the laboratory section.
Is that still the case today?
That was how it started.
Yeah, but is it the case today?
The case today is that some of them have gone through their own professional groups. But that does not still equate them to a position in which that they will want now to start taking the position of the lead trainer.
The guest that just left here said they are not in contention with leadership. They are not looking for popularity or a position.
Yeah,
it's just that things should be done fairly.
Yes, nobody is. That's what I want to say. Nobody is stopping them from doing things fairly. But when they want to do things and they want to go beyond their bounds, let me make some explanation. Everywhere in the world, we have the doctor at the center, and he calls other people to support. But in Nigeria, we had people now who are taking this position that they want to be consultants, as you have heard him say. consultancy services are given to anybody irrespective of where you are. We have media consultants, we have consultants to any other profession. It is acceptable. But in medical parlance, in the hospital area, the consultants are the doctors. They are specialists who takes care of the treatment because they are consultants, because we are talking about patient. A classical example was we have an orthopedic surgeon at Ibadan who did an operation, and the second day he came and said he wants to examine the wound. He was asking the nurse to come and open the place, and they said they have directive from their own consultant not to open it. So a person who has actually done an operation, some other consultant is giving a conflicting information. So by the time you have 2, 3, 4, 5 captains in a ship, we know that we are going for a medical for a shipwreck.
Does this mean that a pharmacist or a physiotherapist cannot be a consultant?
They can be a consultant, but within the hospital, the medically qualified person is the only person that can be a consultant. But you can be a consultant. You can have your own physiotherapist consultant. Anybody can be a consultant, in as much as you have the requisite knowledge and requisite qualification. Okay, but within the hospital setting, the question is, if you are a consultant pharmacist, what work are you going to do? What added advantage are you going to have on that patient care? If you are a consultant nurse, what added work are you going to put in this issue of medical care of that particular patient? They are called consultants because you said this is a gynecologist. A gynecologist is different totally from a first-degree medical doctor who has not had those extra training about that part of medicine.
But look, let's not even go there. First of all, I want you to address the term paramedics. How is that term being used? I don't know, but I would think that to the lay person right now, when you talk of a paramedic, what comes to mind is not a pharmacist. Am I right or wrong on that?
Well, the core medical treatment, the core medical team is the nurse, is the medical doctor, the nurse. Some country put pharmacy, most countries do not put pharmacy.
No, I'm not talking about the medical team. I do know that
I'm saying is that
in many countries now, when you talk of paramedics, they're the first people that get on site in the case of an emergency. Am I right or wrong on that?
Don't come again.
The people who get to site in the case of an emergency, say in an accident situation, in a disaster situation, the first set of people who you get there are the people who are called paramedics.
No. We have different levels of training. We have within those emergency areas, we have some doctors. You can't call them a paramedic. We have some technicians. Those are paramedics. We have some technology scientists. Those are paramedics. I have told you that in the core of medical treatment, the core are the nurses, the doctors. In some countries, pharmacists are regarded as paramedics. In other countries, pharmacists are regarded as part of the core.
What about in this country?
In this country, apart from the nurses, and unfortunately in Nigeria, we don't have a clear-cut definition of a lot of things. Because I mean, over a long time of period.
Because similar to that, a lot of people think paramedics are those first aid responders.
No.
That's also my...
We can have some
and those who are not trained in the medical field as doctors or pharmacists, who are not in that mainstream, just offering fringe services. But they are up in arms saying you cannot refer to them as paramedics.
You mean the pharmacist? Yeah, some countries accept them.
In Nigeria, they say you can refer to them as paramedics. They have full training of medical training. They deal on drugs, they cook the drug. They say, look, you can't refer to us as paramedics. And that's part of why this argument is going back and forth.
The truth about it is that nobody is contesting what they have had their training upon. What we are talking about is the center of the patient care. What is the best for the patient? He has said he has alluded a lot of things why there were strikes. He has said that doctors are perennially on strike. I want
and that you divert patients.
Yeah, I want to take exception to that. If we have 10 doctors, let's assume we have 1 or 2 who show some antisocial duty. You cannot use that one to generalize.
He's not the first person to make the reference.
Yes, we have pharmacists too.